Today we will have a little introduction by myself and the webinar series, and then we'll have an introduction by Chase, our admissions director here at San Jose. Then we will begin the TCM for Infertility lecture, and after that the professor will have a time to answer all those questions. And I'd like to take a moment to encourage you, if you have any questions for the professor, please ask them in the chat box on your GoToWebinar control panel on the side of your screen. So just a little bit about this webinar series. This is the fourth webinar of our TCM webinar series. In this series, we look into how TCM can help many of the common diseases that Americans face today. So please, I encourage you to enroll in more of our webinars. We have another webinar coming up in February, on February 15th. It is going to be TCM for herbology, where we'll look into TCM for Chinese herbs and their functions. And in March, our topic will be TCM for diabetes. So just so everyone knows, our webinars start at 5 and they go till 6 p.m. And again, I'd like to just remind everyone, if you have any questions, please ask them in the chat box on your GoToWebinar control panel. So right now, I'd like to introduce Chase, our admissions director here at San Jose, and he'll be giving you a little bit of information about our new program here at Five Branches University. All right?
Hello, good evening, everyone. Thank you for joining us here today. Yeah, so I wanted to talk just a little bit about Five Branches University and some of the great things that we have to offer our prospective students and students that participate in our programs. One thing that we're really excited about right now is our new dual degree Doctor of Traditional Chinese Medicine and Master's of Traditional Chinese Medicine program. For those of you that are new to the profession of acupuncture and oriental medicine, this is a large step within the development of the profession. Right now, we're one of only 3 schools in the country that have been approved to offer this new dual degree program, so we're very excited to do that. If you have any more information and have any questions regarding the specifics of that degree, feel free to give us a call. Like Faye had mentioned already, you can write a little question on the right side of the screen there, and then we can answer some more of those questions at the end of the webinar today. So today we get an opportunity to get a glimpse into the subtleties of traditional Chinese medicine, and this will be brought to you by one of our experienced faculty members here at Five Branches. We're very lucky at Five Branches to have such a strong and strong and high level of quality professors, and we have a great amount of them as well too. That's one of the main reasons why I chose to attend this university. I just recently graduated in December. So without further ado, I guess we'll go ahead and start this. Our professor that we have visiting us today and teaching this lecture for us is Danling Zhang. She received a bachelor's and master's degree in medicine from Liaoning University of Traditional Chinese Medicine in China. Following her graduation, she became an instructor, a supervisor, and a physician at the university's affiliated hospital there in Liaoning University. Danling then finished her 2-year residency at Dandong Women's and Children's Hospital, specializing in acupuncture research on thyroid diseases. Danling has published numerous papers on eye acupuncture, muscle channel theory, and thyroid diseases. She received her doctorate in acupuncture and oriental medicine from Five Branches University in 2011. She also teaches in our departments of TCM acupuncture and TCM clinical training here at Five Branches University. So please welcome with me Danling Zhang, our professor, and we'll begin this session on infertility.
Hello everyone, this is Danling Zhang. So I will talk about infertility by using TCM. Here. Oh, okay. Yeah, I'm good. Yeah. So first talk about TCM, and then we will talk about the some numbers. So the fact about infertility. Right now, the infertility becomes more and more common in the modern societies. So you guys can see in the PowerPoint. Oh, this way. Thank you. Okay. So sometimes you hear from the advertisement some fertility Western treatment said, okay, about 10% of the women they are having a infertility issue. I think that number is about 2, and then in this area might be a little bit more. So here is the number. So about 60% of the woman aged between 15 to 44 that has it's hard to conceive, and then plus some of the women they have miscarriage or some other reason that cannot carry the baby to full term. That's up to about 12%. So that's relevant to about 10% people they are having fertility issue, and the acupuncture definitely can help. And how we can do it? Normally we do acupuncture and herb together with the Western doctors, and so we have a good result. There was one research done in Europe said acupuncture only together with work together with IVF, and then the IVF rate goes double 50% more. So that's why right now almost every Western doctors will recommend the patient to get acupuncture treatment at the same time while they are getting treated by the Western MDs. And so that's why our patient is we have more and more fertility issue patient. And then we see next slide. So talk about the IVF. This is the last step to conceive. IVF, this according to CDC. CDC is Center for Disease Control. So according to CDC, this is the IVF rate. So if you go with acupuncture, and then this rate can be increased. So also another we see through this, you can see age is an important factor to for the success. And then why? Because sometimes most of the time the Western doctor will say, oh, the quality of the egg is blah 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 blah. So quality of the egg depends on the age. And then so how acupuncture all the herb can help? No, we give the herbs to help. So we said in Chinese medicine, we said this is 25 kidney. So we use 25 kidney herbs to help for the quality of the egg. And also we can do the acupuncture to make people, relax a bit. And then their body goes to the, perform well than normal. And then they will have better quality of egg. And then so talk about the... this is the Western. We said before we know how to Eastern treatment, we need to know the Western part. So Western part, the hypothalamus controls the pituitary, and the pituitary has the gland endocrine system that's a secret LH luteal hormone, and the FSH. FSH is follicle stimulating hormone that controls the secretion of female hormone, estrogen and the progesterone. And then these estrogen can direct affect the quality of the egg, and the progesterone normally we call the pregnancy hormone, and this hormone can keep the woman to conceive and then keep the fetus to the full term. And what we do, this is the picture for the hormone. So what we do, we use herb or acupuncture to help this. So the black line is the ovulation time. So before ovulation, all those numbers, some numbers are low, and then before ovulation, that's the time that we can get to the good quality of the egg. How can we get good quality of the egg? And then we said, okay, we need to make the estrogen number goes high. The the blue line, so the estrogen number to go high, and so that's can have the good quality of the egg. What we do, we tonify the qi, tonify the blood, and then tonify the kidney, and then make the kidney function better. The quality of the egg will be improved. So this is basically if we want to monitor the estrogen level, we can affect the estrogen level. And then when the estrogen going down and then start to ovulate, after ovulation and the estrogen going down and then goes up again, and then the progesterone keep going up steadily. So the progesterone need to go up in a high level at least minimum for 5 days. During this 5 days, if it has the possibility that the embryo can implant and grow. And then this, we call the second part of the progesterone, we call the kidney yang. So we use 25 kidney yang herb, all the points, to help the body temperature keep on a high level. So this basically, before ovulation is we tonify the yin, we tonify the qi, tonify the blood. And then after ovulation, we tonify the yang, so make it happen. And the next slide is about estrogen, progesterone, and then the inner lining of the uterus. So all those linings, some people say, my doctor said my lining is not thick enough. So if it's not thick enough, the embryo cannot implant. If some people, the patient will say, my lining is too thick. Too thick is not good either, because cannot grow. So this cannot, if the lining is too thick, normally it's in the front, the second part and then cannot ovulate. So that's the problem. And the acupuncture can help this. And the herb, especially the herb. And then according to this phase, we call the period phase, day 1 to day 7, we use some herb. And then day 7 to day 14, we use something else. That's phase 2. And then after ovulation, 14 to 21, that's the phase 3. And then phase 4 is from 21 to 28 days. So normally we cope with Western doctor. So depends. If this patient come here and say, I am doing IVF and I just need acupuncture support, and then we just do acupuncture. So we try to relax the patient, and then let all the hormones, secrete normally. If the other patient said, no, I'm young, I'm only 30 years old, I don't want the Western medicine to get involved, and I want to use pure TCM, that's fine. So we will give the patient herb and plus acupuncture, and to make this curve occur. Some people don't ovulate, so there's no curve. So here, this next slide is, you will see the egg, the follicles grow, and then grow to a certain size, and then release. So E2 is the hormone, that's estrogen, to help the follicle grow, and then E3 to release ovulation. After that, progesterone keep up. So all those hormone change is by the body, either by yourself. So we do acupuncture, try to influence the brain, the pituitary, and then the pituitary control the ovary, or either I can just use the herb to just directly tonify the kidney and then make the egg bigger. So that's normally what we do. So also, acupuncture or Chinese medicine goes according to the cycle. So that's why we recommend patient comes once per week to get treatment. And then the next slide is the typical one that's for TCM treatment. So we said there, according to TCM theory, there's if a woman is having problem to conceive, and there are four types of differentiation. So the first one is the normal one, is what we call kidney deficiency, kidney yin or kidney yang or kidney qi deficiency, and then this normally is about the age. So the Western doctors say, that your egg quality is not good. That's once egg quality goes to the kidney part. So we tonify the kidney. We use herb to tonify kidney. And for the patient itself, for the self-care, what can you do? You take some supplement food or supplement to tonify the kidney. And for example, the food, what kind of food can we take to tonify the kidney? So anything, black. So black sesame is good, black bean is good, and the walnut can tonify the kidney, young oyster can tonify the kidney young. For vegetable, like onions can tonify the kidney, and the chives, and then even egg, I will tell a patient, I say, at least you need to have 1 egg minimal per day, especially before ovulating. That's gonna help for have the better quality of the egg. So that's due to the kidney part. And then some other patient say, okay, I'm 30 or I'm even 35, but my kidney is good, my egg quality is pretty good, but I still cannot conceive. Then maybe falls to this one. This is called the liver T stagnation. It's basically, too stressful, too busy, and sometimes, Western said, everything, you are good. Every hormone level test is normal, but just I cannot conceive. And then goes to this category. We need to relax the patient, so we gave patient some herb. So I gave the patient some herb, and then also exercise, meditation, and then can make this. Because once you relaxed, remember the previous slide, and then the hypothalamus, the brain will be relaxed. So, and then the pituitary gonna secrete normally those hormones. So your estrogen, your progesterone will become normal. So we work on the brain part. And then the third one is we call the spleen deficiency, caused the dampness. In this case, spleen is deficiency, so metabolism is a little bit not very well. So normally you will see those patients is overweight. Those kind of patient, or some patient, clinically it's like I'm diagnosed with PCOS, and so in this patient, and then we try to use the herb tonify spleen to remove the dampness, dry the dampness, and then normally it's gonna work. And then the patient maybe ask me, do I need to lose weight until the ideal weight so I can conceive? Not necessary. Just remove the dampness, and then you can get conceived. And the last type is called blood stasis, blood stagnation. Blood stagnation normally typical is some patient come here say, I have endometriosis, I have fallopian tube blocked, in this kind of, and then we just try to invigorate the blood. And if a woman has, indication that some people say, my menses is normal, and some people say my menses is painful. If it's painful, falls to this. And then some people say, my menses is become less and less, and then that might be the first one, the first category. So kidney deficiency. So we use different herbs to do mostly let the period become normal, and then so Chinese word said. If you want to treat the infertility, and then you need to make the menstruation cycle normal, so we will make that normal, and then we treat patient. And then so Chinese medicine is good at treating infertility, and then also lifestyle also helps. So if you come to an acupuncturist, and then they will give you herb, they will give you acupuncture treatment. Also, they will ask you questions about what do you eat, how about your sleep, because they want to make sure everything is all right. And then so this is the basic things you can think. So the food. First, what do you eat? Because what you eat goes to your body and become the you are now. So the food is first we talk about what is good, what we should eat. So first I said, especially before ovulation, you need to eat egg, because egg has high protein, and then the human follicle also has high protein. So you need to eat those stuff, and any kind of dark green veggies, those are good. And also you eat some whole grain food, and so not all carb, not all protein. And then some people say, I don't want to eat fat. No, some of the fat is good, because fat is cholesterol the female hormone estrogen and progesterone, they are from the estrogen. So if a woman is too slim, not enough fat, this woman won't have enough female hormone. Like you see, the marathon runners, the female marathon runners, sometimes they don't have period at all because there's no fat in the body. So, remember, female hormone is from cholesterol. And then now we talk about what we cannot eat. So white stuff, they are not good. So white stuff, white rice, white flour, sweet stuff, those are not good. Everyone knows that, right? And the processed food is not good. So that's just make our body weak. We need to make our body strong. And the spicy food is not good either. And the oilish food, that's, especially oilish food for some people, a little bit overweight, we call dampness, and then this is not good. And some people like to drink milk. Depends. If only 1 cup is fine. That's a good source of protein, but if too much, that's also create dampness. So we don't recommend that. And the coffee, not too much. Maximum 1 cup, it's better not to drink it. And some people, they don't like to say, oh, I'm American coffee. That's my breakfast. I say, okay, one cup. Try to use decaf because caffeine can make you short-term memory improved and also can make you concentrate. That is good, but if a woman too concentrate, cannot relax, those female hormones cannot secrete. The female hormones only can secrete to our body, to the bloodstream, when this woman is relaxed. So food and eat and sleep. So eat and sleep. Sleep is 7 to 8 hours. And some people say, I have night shift. I have to work at night. And then that's tough. That's long time they can become like we call it indeficiency. And so 8 cents is not enough and not enough supply. So that's not. And also sleep quality. Some people say, oh, I sleep. I don't know. I sleep well, but I just have a lot of dream. And the dream is not good. Dream we say this liver qi stagnation. So maybe stress, behind the mind stress, or think too much. So I will ask, okay, your dream is related to your daily life or not? And then you feel refreshed after the sleep. So all those counts. Another thing is what time to go to sleep. 11. Before 11 p.m. is good because 11 to 1, that's the liver time. If so you don't want to damage the liver, you don't want to exhaust the liver, so that's 11 is good. And some people, I have a patient say, I sleep normally 1 to 9. It's pretty good, 8 hours, but that's different. I will say, why don't you just sleep from 11? Because that is your body time. And then, so after sleep, exercise. Exercise, you can do exercise. Here I put moderate exercise. Why? Because you cannot do too much. Too much is not good. Too much in Chinese medicine is that people, I used to have patients say, I run about 20 miles per week. And then this woman cannot get, it's hard, not cannot, it's hard to conceive. Because if you exercise too much, exhaust the kidney. So kidney gene is not enough. It's harder to get pregnant. And some people say, I don't know, ovulate, after ovulate, fertilization, and after fertilization is implantation. And I don't want to exercise too much because I'm afraid that's, after implant, the embryo implant to the uterus, I'm afraid, it might fall off. So I don't want to do exercise. No, still, because once you exercise, your qi and the blood moves smoothly, is easier to conceive. So don't do too much, not too little, not too less. And yoga is good, meditation is good. If you say, I like to run, and then you continue to run, that's fine. And another thing is massage. You can do massage. We call the uterus lifting massage. It's not physically lift the uterus, but that's the energy, that's the qi going up. Going up, how do you do that? You can do self, so you use your hand and put your hands right above the pubic bone and then press deep and then hold it and then pull up a bit. So you do this at least 10 to 20 minutes every day, and then that's help. And then when you do this, you remember you take a deep breath, slow down. So you do like how to say that, like 1 minute, you do 1 or 2 times. So about 10 minutes. So that's massage, that's help, because that's normally uterus is below our pubic, the normal size. So actually when you go down, you can touch the uterus. And then side is the ovary. So we just try to make the local circulation, blood circulation getting better, so we will have better result. So that's and then if you change, some patients, some people will ask, if I do this, and then really can change my hormone level. I say, sure, you can try, definitely can change. And then 1 month or 2 months, and another lab test, it changes. So if you want to do it yourself, that is good, and it does work. It's the best. The worst thing is, some woman come to me and say, my work is really busy, and then I just work and I leave my body to my doctor. My doctor check which number is wrong, and then they give me what kind of medication. I just take it. That's not right. That's I have a patient engineer. You just put the after the ovulation, put the progesterone tablet to the body, and then she need to go to the bathroom at work, and then put it in, and then 5 minutes go back to work, still sitting, and then the tablet cannot be absorbed fully by the body. So you said, I gave you the chart, how much successful rate for IVF. Some people is successful, some are not. Why make that difference? Because some people do it seriously. I use my heart. I really want to get what I want. I do it with my heart, and then normally this patient will conceive. And some people say, that's my doctor's job, and then I don't care. And normally that patient cannot get a good result. So that's for women. And if you have any question, the detail, exact question, and I can answer those questions. And then we talk about infertility, male and also female. And then some people say, female more, male less. Not really. Just because woman has more jobs, men just provide sperm, that's it. And the woman has get the egg, and then also fertilization, implantation. So those all need to be done in woman's body. So women just carry more responsibility. So male infertility, right now I tell patients, I say, male infertility right now is almost nothing. The new technology is very good. You just do stuff, and then normally those fertility numbers will keep going up. So that's once the test is abnormal, don't worry. You change your lifestyle, get those vitamins, those supplement, and then maybe 1 month or 2 months, a couple months later, and then those numbers gonna change. And then what need to change? What does he need to change to make those numbers better? And then those things that we need to change. What we change? So first we do the semen analysis. So if the mortality, mobility, and the amount is abnormal, and then we do the rest, diet and exercise. If is the reason is caused by varicocele, and then that one we need if it's very mild, that's fine. Mostly need surgery. After surgery, it should be fine. So it's just a couple months recovery, and then it should be fine. And then we will produce good quality of the semen. And for male is easy. Normally come here, and then we talk acupuncture and plus herbs. So talk is very important. When we talk, basically ask lifestyle. So what do you eat? And tell the guys the same thing, what you cannot eat. And then very common stuff is coffee, smoke, and alcohol. So those stuff. And then after that, and then you eat healthy, and then keep a healthy body weight, and then should be fine. And then what is the healthy food? We talked about that before. And then also exercise. What kind of exercise is good? Normally any kind of exercise, but some exercise, be careful. What exercise, be careful, is any exercise that can cause a high temperature in the local area. That's not good, because sperm, all the semen's like low temperature. So like biking is not good, and then we'll tell the guy that's change the jeans to the regular loose pant, soft pant. So, and then plus supplement you get, those supplement herbs, vitamins, and then normally should be fine. If it's really a problem, and then the Western medication is very helpful. And then after those medication, the number is gonna increase pretty quick. Like for example, Clomid for women, also for men too. I have a patient took that and then has good result. So this it is. And then for in general, so acupuncture, what acupuncture can help? Acupuncture can help for fertility, that is for sure. And then if you do some of the work, and then you maybe need to come here less. So what kind of work we do is here. So manage your stress level. Stress level, I said, goes to the hypothalamus, goes to the brain, and then that direct affected the estrogen and the progesterone. So how to reduce your stress, and then we talk about that. And then some people said, I think, a lot of women, they just, oh, I want to get pregnant. I don't want anything. I just want to get pregnant. You think about it every day. And then that's not good. So try not to think too much. So I will suggest my patient, if you are a stay-home person, I will say, get a job, because you don't need to think, you won't think a lot. So that's, and another thing is that the last one is I gave positive energy around you. So you need to have support, like your partner will support you, and then you be, you have, you just believe that you can conceive. That is very, very important. Some people come here and say the first visit say, I think it's hard for me. I say, why? Because I'm 35. My egg quality is not good. I say, who said that? You didn't do test. Who said your egg quality is not good? Oh, I have painful menstruation, and then I guess I'm harder to conceive. No, a lot of women just put a block in their mind, that I'm hard to conceive. No, if you get rid of those stress, and then naturally, a woman should get pregnant, unless you something just block it. So that's it. And so that's the information I talk, and then I can give a couple minutes more for talk about the Western. Normally Western is very logical. So the Western protocol for infertility. So you go there. Basically, what's the meaning of infertility is if a woman cannot conceive, if it's under 35, you try it. And then for 1 year and you cannot conceive, and then this is infertility. You go to a doctor, your Western doctor will start to give you treatment. If for over 35 years, normally for 6 months, you try for 6 months and you cannot conceive, and then your doctor will conceive, this is infertility, and then they will start the infertility treatment. Treatment is normally Western, everyone's, all the doctors pretty much the same. The first one is give you the medication that's to promote ovulating good egg. So normally the very common one is Clomid, and sometimes give Femera. Femera normally goes together with PCOS. And then after that, Clomid or those medication for 4 months, you're still not conceiving, and then they will check the fallopian tube, see if it's blocked or not. Normally, mostly, a woman won't be blocked unless has a history of miscarriage or abdominal surgery. Otherwise, no, most of them. But they check it, and after they check it and they still cannot conceive, and then they will do the so-called IUI insemination. Just put the sperm into the uterus, and then so shorten the distance for the sperm to get fertilized with the egg. Insemination can do a couple times, normally 3-4 times, depends on the age. I have a patient do 2 times, got conceive, and I have a patient do like over 10 times, still cannot conceive. But from my experience, this is personal experience, not scientific, younger woman is easier to get conceived by IUI insemination. And then if the insemination, that woman still cannot conceive, normally they will do IVF. IVF is one way of, we call it assisted reproductive technology, so IVF. So they do that, and then that one, the rate I told you is in general is lower than 50%. So that's it. And then so that's why acupuncture, it depends on the age and depends what we want. If you say I don't want Western, and then we do herb and acupuncture. If you think I just want acupuncture, I want to together with the Western, normally we don't give a lot of herb. So this is it. If you have any question, and then you can let me know.
Great. Thank you so much, Professor. You can stay there. I'll scoot over closer to you.
Oh, okay.
Oh, go ahead.
Okay.
So, Professor, we have one question. This is from one of our attendees. She says it's a herbal question.
Mm-hmm.
So she asks, Professor, will turmeric and capsaicin or black pepper be okay for a woman who will receive IVF in 2 months? And she says it's to supplement her pain she has in her body from her foot injury, and she's a woman and she's 41 years old. So she just wants to know if turmeric and capsaicin will be okay for her if she's going to receive IVF in 2 months.
I think that's okay, because turmeric normally is help for the inflammation in the body, and the black pepper is spicy. So you can use it for short term, but you cannot use a very long time, because spicy food normally is 25 yang, so it's going to be good. But if you use long time, that's drain the yin, it's not very good. So.
Okay. And there's one more question. Why is spicy food not good to eat when you're trying to help with infertility?
Okay, that's really, really spicy food, huh? Spicy food normally is we call the spicy food make our body temperature is high, and also make the qi, we call it exhausted qi, make the qi move too much. So during the conservative time, that is not good. Which is conservative time is the time that's post ovulation.
Okay.
So spicy food means, like I said, pepper, chili, those stuff. You can eat small amount, but not a lot. If a lot, then that's gonna drain the qi. The qi gonna be gone.
And we have one more question. How does coffee hurt becoming pregnant or trying to conceive?
Oh, I think I talk about that. Okay. Coffee, yeah. Coffee has caffeine. Caffeine just make you really, really active. So it's basically is like a young energy goes to your body. You become really active, and then also make you concentrate. It's basically is like a help for the adrenal gland. Make you concentrate, make you tight up, make you more productive, and short-term memory is increased. But adrenal gland, once the adrenal gland is working, and then all the blood circulation, all the energies goes on, focus on the work. And then reproductive system, it's not shut down, but just maintain a minimal level. Just let it work, but it won't be very productive. So that's not good for conceive. Conceive means you are not stressed. You are not focused on some other things. And then in this case, you are relaxed, and then the hormones start to secrete. The uterus is soft, and then the fallopian tube is soft. One is soft, is relaxed. So the egg moving through the fallopian tube, and the embryo implant to the uterus lining is much easier. If it tense up, there is no way to implant. So that's why coffee is not preferred.
All right, Professor. This gentleman asks, what will be the treatment in the case of the previous tubal ligation?
What's the treatment? If it's diagnosed like that, because the tube is the place that egg and the sperm fertilize and travel back. So if the tube is not, it's blocked, it's not smooth, or it's narrow, that cannot, is smaller than the embryo, and then the embryo cannot pass through that to go back to the uterus. So that's gonna be a problem. This is one of the main reason for infertility, and then this one need IVF basically. You can use, we can try to use TCM to treat that. For example, acupuncture won't work on that. And then there's, what can we work is the herb. Herb we use, we call this belongs to the blastocyst category. So we invigorate qi in the blood and then remove the stagnation. Hopefully it can help. In China, we do that. But here depends on the individual and also the age. If it's age 40, I think infertility, IVF may be a right choice.
All right. And we have another question. He asks, what is the general thinking on supplementing with herbs for a woman who has not been diagnosed as infertile but plans to become pregnant and wishes to tonify and balance for optimal health for mother and baby?
This is very good. I like this question, and I like to see patient like this. Not like I have a problem and then I tried and then come here. This is not good. This is good. So I like this. So basically, so supplement, basically, if you want to have a baby, you take prenatal vitamin. If you said, I don't want to in couple months, in 3 months, and you take regular vitamin. And then you take some folic acid because that can help prevent for abnormal stuff. And then also herb depends. I recommend this person come to acupuncture at least once. So we do a pulse and tongue and ask some general information, and then we say, okay, your body is yin and yang, whatever is a little bit I call it unbalanced. It's not a problem. And then give some herb to take it. Herb take it normally is normally 1 to 3 months, and their body that's a good word, optimize the body, and then that's gonna be much easier to get conceived, and then this is good, and it's easier to treat this way, and then you have a problem, and then we have to do a whole bunch of work. Yes, I like to see this. So go to acupuncturist for once, and then talk about the herb, because herb is normally we don't like patient take for more than 3 months. So we take this one for 1 month and then come back and then see how is it, and then we can change a little bit. Maybe 1 month later is good.
And then this person asks, Danling, would you like to mention key formulas to benefit each phase? Blood tonifiers, Siu Wang Tong for phase 1, Liu Wei Dan Huan phase 2, Yu Gui 1 for phase 3.
Okay. Yes, this is according to the Western, I guess this is someone who knows TCM.
Yeah.
Yeah, so phase, would you like to mention, the key formula? Okay. So formula is maybe a little bit different, but the herb will be, once it modified, pretty much similar. So the first phase is day 1 to 7. So we want the period to flow normal. So we use Tao Hong Si Wu Tang. So Tao Ren Hong Hua, that's invigorate the blood, and the plus Si Wu Tang is tonify the blood. So that's day 1 to day 7. And then after day 7, and then the bleeding is gone, period is gone, and then that phase 2 is very important, especially for the person who wants good quality of egg. It's here. So start from day 4 to day 14. That's the only frame that you can make a good quality of the egg. So in this one, we tonify qi, tonify blood. So tonify qi, tonify blood. On phase 2, we use Bajin 1, modify. So Bajin 1 is Si Wu Tang plus Si Junzi Tang, tonify qi, tonify blood. And the phase 3 is, and also after phase 2 on day 14, if you take Bach herb, I will add a tiny bit invigorate blood, not Tong Ren Heng Hua, it's Denshin, to invigorate blood. And then because why? That's a help for release of the egg, so help for the ovulation. That's only for the frame is about 2 days. Time frame is 2 days. And after that, day 14 to day 21 or day 14 to 28, that's 2 weeks. We call the tonified kidney. Tonified kidney, you can use Liu Wei Di Huang 1, or you can use Yu Gui 1. The one is tonified kidney yin, one is tonified kidney yang. I will use something else, but the principle is the same, it's tonified kidney. So I will use, there's one formula called 受胎丸, longevity of the fetus. It's 4 herbs, 湿生断胶, 菟丝子, 桑寄生, 续断, 阿胶, and plus some other herb, 25 kidney, mild 25 kidney herbs. So make it go through. So basically it's 25 kidney herb, so keep the body temperature high. And then that is help for the progesterone. And also, if this patient has any possibility to cause miscarriage during this time, I will tell the patient go to Whole Food to buy the progesterone cream at Whole Food and use it, rub it on the lower abdomen, inner side. So the same function of the herb.
And kind of on the other side of the spectrum, Professor, another person asks, what is your perspective of birth control contraceptives?
Okay, good. Not for infertility, the other one, huh? Okay.
On the other side.
On the other side. Okay, birth control is birth control pill basically is a mix, is a female hormone. So basically female hormone, that's so just you take something for 21 days and then take something. You stop taking that one, and then because you take that and then controls the body, the hormone, and then after you stop that, and then it's just like a release, and then so the blood will come. So in Chinese we call 突破流血 is period, but that period is not naturally formed by your body. It's just because the medication, the hormone is gone, so just your uterus lining just start to bleeding. And a small amount is good, and then you can take it. The only thing is you cannot take it for too long. If you take it for too long, I have a patient take it for 7 years, 10 years, and later on become infertility. Why? Because that hormone is not released by the ovary. Ovary release estrogen and the progesterone. It's just outside take, so the ovary become lazy. It doesn't produce hormone for so many years, and then once you stop the birth control pill, and then the ovary is like a rock. You do ultrasound, is hardening, so that ovary is not working. So that's not good. So that's so birth control and the contraception, that is good. Depends on the age. But there's one thing I need to say. Some people check the safety time. Ovulation is between day 9 to day 19. So during this window, and if I'm before day 9 from the first day of period, and after day 19 I'm safe, I try. That's not safe. That's the only thing I want to tell young people. Don't try that. You may, if you get one, because ovulation sometimes can affect by other factors. So typical is day 14 you ovulate, but something happened. I fight with my boyfriend. Kidding. and then I might ovulate early.
Okay.
So it's not safe enough.
All right.
Okay. Thank you.
All right. Thank you so much, Professor.
You're welcome.
And thank you guys for your questions. Okay. All right. Thank you guys so much for joining us. I hope we got all your questions asked. It looks like we did. I'd just like to go over our next webinar will be in February, and that day is February 15th, and it will be TCM for herbology, and that will be with another professor of ours. So we hope you join us. And just really quick, if you haven't already and you'd like to, please just go to our website, www.fivebranches.edu. You can see it here on my screen. And you can click reserve your seat in our free webinar and events, and that will take you to this page with a form on it. And you can click live webinar TCM for herbology is our next one. I also encourage you to sign up for an enrollment info session, which is coming up also in February on the 18th. And that's cool because we have 2 sessions, one in English and one in Chinese. The English one will be done at 5 p.m. and in Chinese at 6 p.m. So we look forward to having you guys join us again for our next webinar or enrollment session. We look forward to seeing you guys. Thank you so much. All right, bye.